Hi all, very good evening team. In today's session, we are going to have a demo on CPMA training. So coming to CPMA, Certified Professional Medical Auditor. So the full form is Certified Professional Medical Auditor. This certification is provided by AAPC. So coming to the agenda for today. So today we are going to discuss who can take this CPMA exam and the exam pattern, syllabus, and course details. Okay, so coming to the first question, who can take this exam? Candidates with minimum 6 months of coding experience. So candidates should have at least 6 months of medical coding experience. It can be of any facility, outpatient coding or IPDRG coding, HCZ coding. So in case of outpatient, you may have worked as a surgery coder, radiology, pathology coder, anesthesia coder, whatever it may be. But at least 6 months of coding experience is required to take this exam because this is an advanced level exam. So a basic knowledge is required. Basic knowledge about medical coding is required. Next, coming to the CPMA exam pattern. So you are going to get 100 multiple choice questions. 100 multiple choice questions. And the duration for this exam is 4 hours and it's an online based exam. And you'll be having 2 attempts. So if you're not able to clear your exam in first attempt, then you can go for the second attempt. And the pass percentage is 70%. That is, out of 100 MCQs, you have to get 70 MCQs correct to clear this exam. Okay. So next, coming to the exam breakdown, like from which topic you'll be getting the number of questions that we will discuss. So first one is medical record standards and documentation guidelines. From this, you will be getting 17 multiple choice questions. So multiple choice questions means under each question, you will be having 4 options and in that you have to choose the correct one. So next part is from coding and documentation compliance guidelines. There will be 21 marks. So this chapter is having the highest weightage. From this chapter alone, that is from compliance chapter alone, there will be 21 multiple choice questions. And next one is coding and reimbursement concepts. From this, you will be getting 13 questions. So coding and reimbursement concept means nothing but from the CPT coding guidelines. CPT, that is surgery coding guidelines, E&M coding guidelines. So from this, you will be getting 13 questions. Next, coming to the sampling methodologies and auditing. From this, you will be getting 7 multiple choice questions. And risk analysis and communication of result. From this, you will be getting 6 questions. And finally, you are having 36 marks from 15 audit cases. There will be 15 audit cases, and from that, you are going to get from 15 case studies, you are going to get 36 marks. So under each case study, you can expect 1, 2, or maximum 3 questions will be there under each case study. Okay. So let us discuss in detail about these chapters, which we have discussed in the previous slide. Coming to medical record standards and documentation guidelines. And you are going to get 17 multiple choice questions from this. So coming to HIPAA, that is Health Insurance Portability and Accountability Act and Privacy Regulations. So from this, there will be that is HIPAA. HIPAA means this health insurance portability and accountability. Like if a person is working in one company and he want to shift to another company, from company A to company B, he is shifting, means then his health insurance should continue, right? So that is ensured by this HIPAA. And accountability. So accountability means healthcare providers and we medical coders, medical transcriptionists. So we are working with patient's protected health information. So we are using the patient's personal information. So we should use it with caution. We should not disclose it to any others. And we are responsible for the information which we are dealing with. So that is ensured by the HIPAA. Next, coming to the types and components of a medical record. So types and components of medical record means nothing but how an outpatient case study will look like and how an inpatient case study will look like. What are all the forms present in a medical record? That is admission form, consent form, like that. What are the forms present in that? And reports. What are all the reports which will be present in a medical record? That is radiology report, pathology report, EKG report, consultation reports, like that, and operative report. So these things will be discussed in detail. So if you take operative report, means what are the contents of an operative report? What are the contents of an radiology report? In this way, we'll discuss each thing in detail. Next, coming to accreditation standards. Then accreditation standards, we will discuss what does mean by accreditation, whether it is a voluntary one or a mandatory one, and what are the accrediting agencies and what are their requirements, those things will be discussed. Next, coming to the coding and documentation compliance guidelines. As I said, so this chapter is having the highest weightage. From this chapter alone, we are going to get 21 multiple choice questions. The topics covered include fraud and abuse. So we'll discuss what does mean by fraud, what does mean by abuse, and what does mean by Federal False Claims Act, those things. So let me explain this fraud and abuse. So fraud means nothing but intentionally doing something wrong. So intentionally submitting a fraudulent claim, intentionally upcoding, intentionally downcoding. So those things come under fraud. Whereas coming to abuse, this abuse can happen unknowingly also, but it will cost unnecessary cost to the federal healthcare program. Say for example, a provider is giving treatment to the patient and he is somewhat inexperienced provider, that is inexperienced physician. So he is ordering a lot of tests, lab tests he is ordering, which is totally unrelated to the patient's signs and symptoms. So this is an example of abuse because he is not intentionally doing this. So this is an example of abuse. Then we'll discuss about False Claims Act, Anti-Kickback Law. First, we'll discuss what does mean by kickback, and Star Law. Star Law is exclusively for the physicians. So if physicians are doing something wrong, like if they are self-referring their patients. So assume that I'm a orthopedic surgeon and my brother is a physiotherapist. So I'm sending all my patients to the to my brother for the physiotherapy for monetary benefits, means then definitely I'll be getting punishment from the Star Law. Then we will discuss about exclusion statute, like what does mean by exclusion statute, how many years a person or an organization will be excluded. Then coming to the money penalties. So how much money penalty will be imposed. These things will be discussed, and we will have an in-depth discussion about OIG, Office of the Inspector General, and what are their roles and responsibilities, what they are doing with healthcare fraud and abuse cases. Those things will be discussed. And last but not least is the CMS, that is Center for Medicare and Medicaid Services, because this is the governing agency for the Medicare and Medicaid, that is federal insurance. Okay. So next part is the coding and reimbursement concept. From this, there will be 13 MCQs. So coding and reimbursement concept means nothing but from coding guidelines. Say, for example, from modifiers, when we can use 50 modifier, like what is the purpose of 50 modifier? What is the purpose of 51 modifier? Then when we will use 59, then somewhat they'll give some 4 code pairs and they will ask which one is unbundled here. So from CABG guidelines, herniorrhaphy guidelines, so from CPT coding guidelines, that is from E&M and surgery and pathology, radiology guidelines and medicine guidelines, there will be 13 questions. And finally, physicians at teaching hospital guidelines. So physicians at teaching hospitals means nothing but physicians who are studying in medical college. That is after, so if you take India means after MBBS. Okay. So coming to physician at teaching hospital guidelines. So physician at teaching hospitals means nothing but physicians who are studying at medical college. Say, for example, in India, if you take after completing MBBS, there is post graduation, MD and MS, right? And after that, we are having super specialty also, MCH, DM, DNB, like that. So we will be discussing about what type of guidelines they should follow in a teaching hospital. Those things will be discussed. Okay. So next, coming to the auditing, that is scope and statistical sampling methodologies. From this, you will be getting 7 MCQs. So coming to the topics covered under this, we'll discuss about audit. So what is mean by audit? And what are all the different types of audit? Because we are having different types of audit: internal audit, external audit, prospective audit, retrospective audit. So like this, we are having different types of audit. So we will discuss the types of auditing in detail. Then coming to the sampling methodology, like how we will select samples for an audit, because it's not possible for an auditor to audit all the medical records in a particular year. Say, for example, assume that I'm going to audit a particular hospital. So it's not possible for me to audit all the patient case studies for a specific span of time. Say, for example, 3 months, 6 months, or 1 year. So it's not possible for me to audit thousands of records. So we need to use some sampling methodology to select a specific number of samples. Say, for example, 50 samples, 100 samples, 80 samples, like that. We need to use some statistical methodology to select those samples. So those methodologies we will discuss. And then we will discuss about utilization review. So utilization review is nothing but how frequently a code is utilized. How frequently a code is used by a particular hospital. This is what utilization review is. And we will discuss about the RATSTAT software and how we are using this. Those things we will discuss. Next, coming to category risk analysis and communication. From this, you will be getting 6 multiple choice questions. So after conducting an audit, like we will discuss the steps in the audit in the previous chapter itself, like in the auditing, types of audit and what are the steps involved in auditing and all we will discuss. So after conducting an audit, we need to publish the result. We need to write the report, and this report should be submitted to the hospital, and we need to communicate this report to the hospital. So how we need to write an audit report, that we will discuss. How to validate audit results and how to generate a report. Then after generating the report, we need to communicate this to the hospital management. So in case of communication, we are having 2 types of communication. One is oral communication and another one is written communication. So that will be discussed. And finally, coming to the medical record abstraction. From this alone, we are having 36 marks. And for this, you will be getting 15 audit case studies. So audit case studies means nothing but a case sheet they will give. Under that, fee ticket also they will give. Fee ticket means like what are the codes which they have picked for this case study, that also they will give, and the bill amount also they will give. So we need to check whether they have taken the right ICD code and right CPT and HIPICS code. This we need to check. And we need to check if there is any error in this case study. Say, for example, there can be a discrepancy in the date. Okay, so in the date, in the operative report, they have given one date, and in the fee ticket, they have given some different date. So there can be a discrepancy in the date. There can be a discrepancy in the physician's signature. Sometimes signature may be missing, and sometimes a part of report can be missing. Say, for example, if you take operative report, if the type of anesthesia is missing, that we need to identify. So this particular thing is missing, anesthesia is missing here, or blood loss details is missing, indications for surgery is missing. Like that, we need to identify the error in that. No need to worry about this because this is also multiple choice question only. Okay, so there will be a case study. Under that case study, they'll give a question. Either they'll give one question, 2 or maximum 3 questions will be there. Under each question, there will be 4 options. From that only you are going to select. Okay, so coming to our course, so we will be covering CPT, ICD coding guidelines, and then we will discuss about the topics related to auditing part. And coming to the class duration, so sessions will be for 90 minutes, that is 1.5 hours. Your sessions will be 1.5 hours. And coming to the duration of the course. So if you ask about the duration of the course, it is it is based on the skill of the candidate. Because if you're very strong in ICD coding guidelines, then it's not necessary for me to cover the ICD coding guidelines. Whereas if you're already working as a surgery coder, or if you're working as an IP coder, like that means, then you will be aware of the coding guidelines. Or if you have already CCS certified means, then you'll be aware of the CPT coding guidelines and ICD coding guidelines. So you can easily clear the exam. Whereas if you are not aware of the coding guidelines, say for example, you have worked only in HCC coding, and if you are not aware of CPT coding guidelines means, then I need to cover the CPT coding guidelines. Then I need to move on to the auditing part. So the duration of the course is based on the candidate's skill. And the mode of training will be online team. So online training, we are not providing classroom training, online training, and the timing will be 90 minutes. Okay. So team, if you do have any doubts, you can contact our HR team. Doubts are always welcome. Thank you all. Thank you, team.